I'm Rob Dansman, and this is The Better Semester, where I provide insight and actionable advice to parents of college students. I'm a nationally certified counselor and licensed clinical mental health counselor, specializing in work with college students and their parents to improve mental health, organization, and motivation. Medication during the semester. Today, I'm talking about medication. This is one of the topics parents of college students underappreciate in terms of how good or bad things can get. I'm not going to go into specific medications or recommendations today, but I will be providing some actionable stuff you can do to help your college student navigate their medication and management of medication. My recommendations are similar to those I discussed in my previous episode on how to find a therapist. As a quick reminder, the basic premise is to figure out whether a home or a school provider, psychiatrist or nurse practitioner, is best for medication management. If your college student is on medication they've taken for a while, it might be best to just use your psychiatrist or nurse practitioner at home, since they don't need to meet very often. If they're just getting started with therapy, trying different medications, and it's early on, it's probably best to have someone close to school. They're going to need to meet probably about monthly. Next up, don't change medication with less than 3 weeks of school starting. Don't add, increase, decrease, or quit a medication. Lots of antidepressants and anti-anxiety medications have nasty side effects, like increased suicidality, even when someone didn't want to kill themselves before. They also might have no impact, or maybe a significant impact, unless your college student allows for several weeks to see what, if any, impact the medication has. Changing medication as they're going back to school is a pretty bad idea. If they've gotten their medication nailed down, we need to make sure the psychiatrist or prescriber is willing to provide refills if your college student is studying out of state. If they're not willing to do that, we need to plan for having someone else provide refills. Line up a visit at home to meet with the psychiatrist, or have enough refills prescribed so they won't run out while at school. Refills are a perennial issue with students since many of them don't have fully formed prefrontal cortexes yet. Planning ahead is just not their thing. If they fail to plan out studying for a test, the impact is contained to a bad grade. But if they fail to get refills for their medication, this could have far-reaching consequences that affect academics, sleep, mood, and all areas of their life. This is something parents need to help with since the risks are too significant. Students have got to make sure they have their medication refilled right before they arrive at school. It's not a bad idea to schedule psychiatrist appointments as soon as the semester starts. If your college student is working with someone around school or someone at home, get appointments scheduled out for breaks or possible long weekends. It's super tough getting appointments with only a few weeks' notice, so do this early. If your college student is severely struggling, get medication management sessions set up for each month. If they're just needing maintenance and things are pretty chill, 3 times per semester is probably good enough. Once we've nailed down what psychiatrist to use and landed on what seems to be the right medication, the next issue is how to make sure your college student is taking it as prescribed. I've worked with countless students who complain about not feeling better, yet when I ask them about their medication, they tell me they sometimes miss doses. Some tell me they take it when they feel like they need it. Others might take medication at the wrong time of day. These are not random supplements or ibuprofen. These are serious compounds that can have substantial side effects. Another issue I hear very often is not necessarily about medication, but disrupted sleep. When I dig a little, I sometimes hear that the student, instead of taking their ADHD medication, which is likely a stimulant, in the morning, they're taking it much later in the day. I thought I was supposed to take it when I wake up, and I don't get up until 11 or 12. No, it's not for when you wake up, it's for the morning, so it's as far away from your sleep as possible since stimulants keep you awake. My response to all of them is this. If you had cancer, you wouldn't take your cancer treatment drugs, quote unquote, when you feel like it. You take them exactly when and how the prescribing doctor instructed. Now, I get it that parents can't provide daily oversight and ensure medication compliance, but there is an opportunity to regularly ask about medication and be blunt. It's okay to ask. Not, are you taking your medication regularly, but when was the last time you missed taking your medication? And what side effects are you having from your medication? Those may seem like questions best left for the doctor, but if you ask them every few weeks, you'll be setting a clear expectation that until the doctor recommends differently, they need to follow exactly what the prescription says to do. Okay, that's it for now. That's it for this episode on medication. For more information, check out my blog at motivatecounseling.com or my 2 books on Amazon. Just search for my name, Rob Dansman.